Okay, thank you for waiting. As the title indicates, my presentation is about autism, which is caused by a SHANK3 mutation. And specifically, I am interested in muscle weakness. First, I want to give you some information about autism. Autism spectrum disorder encompass a broad range of neurodevelopmental disorders categorized according to various and severely diverse symptoms. So these development disorders are particularly noticeable in the first 3 years of life, which are manifested by social communication impairment and restricted interest and repetitive behavior. The underlying reason for ASD is still unknown. However, the occurrence for the symptoms can be caused by genetic and environmental factors. It is known that SHANK mutations account for approximately 1% of patients with ASD. So the SHANK protein family consists of SHANK1, SHANK2, and SHANK3, and these are synaptic scaffolding proteins, which have a role in recruiting and stabilizing neurotransmitter receptors and the actin cytoskeleton in excitatory synapses of the brain. All three members, so SHANK1, SHANK2, and SHANK3, are associated with ASD. However, a deletion of SHANK3 reveals the most severe phenotype, like intellectual disability and Polymectomic syndrome. And that's why I am focused on SHANK3. So SHANK3 is localized on the long arm of chromosome 22. Those mutation leads to an haploinsufficiency of the SHANK3 and causes Polymectomic syndrome. Polymectomic syndrome is a syndromic form of autism, so autism spectrum disorders, manifested as a rare genetic developmental disorder consisting of global developmental delay, absent or delayed speech, ASD-like behavior, and neonatal hypotonia. And we want to unravel why 75% of the PMDS patients have a low muscle tone. But first, I want to just explain shortly how a muscle contraction takes place. So when an alpha motor neuron is depolarized, it releases acetylcholine into the synaptic cleft. These acetylcholine molecules bind to the acetylcholine receptor on the sarcomere, and then they lead to opening of these receptors, which leads to an action potential, which then leads to muscle contraction. Yeah, and since PMDS patients have low muscle tone, we want to investigate anatomical changes in the motor neurons, in the neuromuscular junctions, so that's the sinus between the motor neuron and the muscle, and in the muscle itself. Therefore, we use the mouse line that harbor a specific deletion of SHANK3, which leads to a partial deletion of SHANK3 isoforms. So we still have some SHANK3 protein. First, we made a muscular grip strength on hanging wire test, and here you can see the knockout, and on the top that's the wild time, and we have seen that the SHANK3 knockout mice has a reduced grip strength, muscular grip strength in young SHANK3 mice. So they reflect hypotonia in Polymectomic syndrome. Then we stained cryosections from the spinal cord, from the lumbar part. And then we stained against MAP2. So MAP2 is positive, or is called for microtubule-associated protein 2, and it's a marker for alpha motor neurons. And then we also stained against SHANK3, and we revealed that those mice have a less SHANK3 intensity in the soma of the motor neurons. Yeah, and also the soma size was decreased in the SHANK3 knockout mice. Then, to closely analyze neuromuscular junction structure in mouse skeletal muscle tissue, we labeled whole mounts, so the whole muscles, with Berra toxin. Berra toxin is a toxin that label acetylcholine receptors, and we have found that SHANK3 co-localized with Berra toxin. Here you can see it in the postsynaptic neuromuscular junctions compartment in adult mice. So in the muscle, we have found that SHANK3 is co-localized with alpha-actinine. So we have here the sarcomere, that's the smallest unit of a muscle. Here we have the Z disc. So it's the border of the sarcomere, and the Z discs contain a lot of protein, but the most prominent protein is alpha-actinine. So if we stay in the muscle, the alpha-actinine is the marker for that. And we have shown that SHANK3 is localized here, especially. And yeah, then we checked for the expression of SHANK3. And here we can see that the SHANK3 isoform A, C, D, and E were almost absent, whereas the isoform at 120 kilodalton was not reduced. Then we co-immunoprecipitated SHANK3 and alpha-actinine and found that the two form a complex. And especially the SHANK3 isoform at 120 kilodalton was detected in the co-immunoprecipitate with alpha-actinine. So we showed that SHANK3 forms a complex with alpha-actinine and co-localizing to sarcomeric Z disc in muscle cells, and thus we propose SHANK3 as an important scaffolding protein that defines and stabilizes sarcomeres. To closely analyze neuromuscular junction structures in skeletal muscle tissue, whole mounts were labeled with Berra toxin, again to label the acetylcholine receptors. And Berra toxin positive areas of day 0 mice were classified as wave, oval, crescent, and complex form with increasing maturation. So the complex form is the more mature structure. And in SHANK3 knockout mice, the categorization pattern was considerably altered. So SHANK3 knockout mice of all ages demonstrated a smaller Berra toxin area, here especially for day 0. And for day 0, the mature complex form was significantly decreased. Here you can see it for day 35 and day 58. Mice, the Berra toxin area is decreased. The altostructure analysis of skeletal muscle sarcomeres demonstrated revealed a normal axon terminal for the SHANK3 wild type. So for the SHANK3 wild type mice, so they have a complex postsynaptic membrane folding with properly formed secondary synaptic cleft and a well-developed postsynaptic membrane. And in contrast, SHANK3 mice, SHANK3 knockout mice, displayed an undefined postsynaptic cleft with less complex postsynaptic folding, as shown by fewer branches. And we postulate that the SHANK3 loss leads to immature end plates. So, altostructural analysis of skeletal muscle sarcomeres demonstrated considerably thinner Z disc width in SHANK3 knockout mice in all ages. So we measured the Z disc and the A band, because during the contraction, these are the only structures that are not getting shortened or getting longer, so they are stable. And they were thinner in all knockouts. In contrast, the A-band length was increased in newborns, but unchanged in young and adult Shank3 knockout mice, so suggesting differential developmental regulation of sarcomere organization under Shank3 deficiency. Then the muscular grip, then we made again the muscular grip strength, and this could be, so the grip strength could be increased with the fast skeletal muscle troponin activated teracentive in both wild type and Shank3 knockout mice. So teracentive has a direct target on muscle contraction, and the grip strength in Shank3 knockout mice was improved to the same extent as in wild type mice, so suggesting that the cause for hypotonia and reduced muscle force was due to a less mature state. So for further investigate the potential clinical importance of our murine finding, we obtained skeletal muscle biopsies from 3 patients with PMDS, and they were between 20 years old and 58 years old, and they all shared an autistic clinical manifestation and Shank3 deficiency. And we had also a corresponding control. So first, we wanted to know how the Shank3 expression looks like and its intensity. So regarding protein, Shank3 has a pattern like alpha-actinine, and regarding their intensity, it was reduced in the 2-year-old patient with PMDS, but not in the young or in the old patient. So indicative for age-related Shank3 compensation. Then we checked the NMJ complexity in ultrastructure, and we have found that the NMJ complexity was decreased in 22 years old and 58 years old patient, but not in 2 years old patient. So which presented a broader range in the number of foldings. So consequent.
Yeah, for Jagir, the former goalie. Yeah, J.S. Jagir. I know. But you of all people, yeah, I know. Everyone thinks it's from the song, and we're like, no, it's from the hockey player.
So I'm just gonna, I gotta take care of Disneyland today.
Oh, how fun!
Yeah. So it's gonna work.
Okay. Okay, so yeah, whatever's easier. If it's easier to bring him over to your house or to leave him at our house, it's fine. It's only one night, so. Yeah. Okay. Thank you.
Okay.
I'm sorry for the disturbance. Yeah, you can keep it.
Yeah, I said that the foldings were unchanged in the child, and consequently, so less amount of folding as well as receded folding length would result in less transmitter receptor, thus weaker generation of action, so end plate potential and muscle end plate action potential that would lead to impeded muscle contraction. Similar to mice, the zaptics, we also measured the zap disc width and the A-band. And the zaptics were smaller in all patients with PMDS. You can see it here. And in the biopsies, the A-band alterations demonstrated interesting dynamics as they were wider in young and adult patients as observed in young mice. Then, in addition, also in ultrastructure, we could detect a wide sarcoplasmatic reticulum in all biopsies of patients with PMDS. These are these structures. And therefore, to to display the sarcoplasmatic area, we used an antibody against calciquestrine, since calciquestrine is a calcium binding and storage protein in the sarcoplasmatic reticulum. So by staining against calciquestrine, we would display the sarcoplasmatic reticulum. And we demonstrated that SHANK3 mutation affects the calciquestrine polymerization and leads to an enlargement of the sarcoplasmatic reticulum and the calcium binding protein calcium, calciquestrine accumulation, hinting at molecular changing in the calcium storage and release system in the muscle cells. So with our findings, we have two important aspects that arise. The first is that SHANK3 localizes in the neuromuscular junctions and in the receptors of striated muscles. And the second one is that SHANK3 is a fundamental protein driving maturation of these structures. And we propose that SHANK3 loss is detrimental for the maturation of complex neuronal and muscular structures, so including human neuromuscular junction, which was reflected in the immature morphology of neuromuscular junctions from patients with PMDS. SHANK3 is implicated in the maturation of central nervous system synapses, so suggesting that it might play a comparable role in the peripheral nervous system and in the skeletal muscle. So we propose that the hypotonia in SHANK3 deficiency, such as in the PMDS patients, might be caused by dysfunctions in all elements of the voluntary system. So the motor neurons, the neuromuscular junctions, and the sarcomeres. So we hypothesize that these functional defects might add up the clinical appearance we observe in patients with PMDS. So a lack of SHANK3 results in thinning of the Z disc. Maybe it leads to an instability of the Z disc. Consequently, whole sarcomere stability is influenced, and which in turn affects the muscle tone and muscular strength. So within maturation of the neuromuscular junction complexity, it gets less complex in the PMDS patients. And we have some hypotheses for the role of SHANK3 in neuromuscular junctions and striated muscle. First one is the neuronal influence on the muscle into the end plate. Second, the neuromuscular formation and maturation, sarcomere formation and maturation, and the contraction and muscle tone. So with that, I thank you for your attention. And yeah, do you have any questions? It doesn't seem so.